Experts say Taiwan should lower the threshold that COVID patients must reach before being discharged from the hospital. Currently, patients need to produce a CT number of at least 35 to be judged free of COVID. But this threshold is hard to many patients to reach, even when all other evidence shows that they are not infectious. Experts say patients can be safely released once they produce a CT number of at least 34.
到后来就是阴阴阳阳状态，那个都是在34以上的。
Toward the end of the treatment, patients tend to test positive and then negative and then positive. They tend to have a CT value that's above 34. We've read up on a lot of research, and we know that those with a CT value of 34 or more are unlikely to fall ill again. In other words, they did not pose much of a threat to people around them.
如果符合2个条件，其实可以解除。第一个条件是它不是重症。
If they meet 2 criteria, they can be let out. The first is that they didn't suffer a severe case. If their PCR test is negative, of course they can be let out. If their PCR test is positive but very weak, with a CT value of around 34, generally speaking, their infection rate will be close to 0.
There are currently 127 COVID patients still in hospital care. Under current protocols, they'll need to test negative twice in a row. Experts say that lowering the CT threshold to 34 would be beneficial for patients' mental well-being and conserve medical resources.